I mean, Brenna, let me ask you this question, because you're, a little bit younger than me. And what do you think, do you think when someone says that they have had plastic surgery, do people look down on them? Do they not care? Or do they think, oh, yeah, that was great? As a young person, what do you think?
Oh, I think it depends.
You think it does depend?
Like, my age group, I feel like it's not really down. Like, I don't think it's a bad thing. I feel like older generations would be like, oh, like, why would they do that?
Right.
Know.
Okay.
Like, I feel like
well, that makes sense, because what I would say is historically, people would look down on other people that had plastic surgery, right? Mm-hmm. And I think there's been a pretty big shift, and it's happened fairly recently. I think it's been kind of gradual, but definitely with the rise of social media. But I saw a really interesting article that came out of Vogue, and it asked, was 2025 the year that admitting you had plastic surgery became cool? And you know what? I think that this article was pretty accurate. I think it's not just 2025, where in 2024, if you said you had plastic surgery, everyone thought you were the devil, and then suddenly in 25 it was good again. But man, I really will agree that in 2025 we had a lot of celebrities coming out and sharing their plastic surgery journeys, which is kind of new. Like in the past, like celebrities that you obviously knew had plastic surgery would take it to their grave, like, oh no.
Yeah, it's like way more normalized.
It's been way more normalized, and social media definitely has played a big part in that. Mm-hmm. So, and I think also too, and this kind of concerns us. I think the rise of podcasts has also made people more open. I definitely think social media is the biggest driver, but also, you get, when these celebrities get in these very informal type sessions where it's a podcast and it looks like you're just hanging out in someone's living room, I kind of think they open up more. I don't know. Do you think that? I know we just discussed that neither one of us watch a lot of podcasts. I mean, I watch podcasts when I'm getting information for segments, but it's not like I have like a list of podcasts I watch.
Have you heard of Call Her Daddy?
Yes, we did it.
I like that. Immediately thought of that one.
Because of,
she has all the celebrities.
Who is that girl that was like the Megan Fox?
Yes.
Was it Megan Fox who was on Call Her Daddy and she was talking about her plastic surgery?
I didn't watch that. I saw, I know Kim Kardashian was on
it
was
too.
She? I didn't see the Megan Fox
We did a whole segment on a celebrity plastic surgery that it was the same exact thing. She was on Call Her Daddy and she would just like, blah, this is what I've had done. And it was all like new. And so I definitely think that podcasts have contributed to a lot of these celebrities opening up, which then what happens? Then the average people starts opening up, because if celebrities are talking about their plastic surgery, it's suddenly less taboo. And then you get like the suburban house moms that are talking about their plastic surgery journey on a TikTok series. I see that stuff all the time. I've even had some of my patients do it, which is totally fine with me because it's just free advertising. And so I definitely think that there's been a lot more people in the past years, but I do agree that 2025 was almost kind of like a tipping point where, suddenly everyone was talking about, I've had this done, or I'm thinking about having this done. And it's really been kind of a change. And so if you look at the data does agree. Content about specific procedures such as facelift, eyelid surgery, rhinoplasty, certain breast surgeries all saw a dramatic increase in searches and posts.
Like lip flips or lip injections
lip flips,
too.
yeah.
Like that's
lip injections.
Even like people I know. Like I know so many people that have done it.
Well, listen, you're an expert now, Brenna. And so when your friends start talking about doing their lips, I want you to say this. Are you ready?
Yes.
Okay. It's okay to do your lips, but please, for the love of God, don't do too much. Mm-hmm. Because there is a super fine line between I'm getting lip filler and my lips are looking better and better and better, and then whoosh, suddenly you look like Madonna in her alien phase.
I gotta show you some off screen, and I gotta get your opinion.
Okay, definitely. Yeah, I want to see him. See him definitely. So oddly, looking at like what's been hot lately on social media, Botox posts are down. Some of the filler posts are down as well. And I think this may go to what we've talked about in the past, that the overdone look is like getting a little out of vogue, which I'm totally here for that. I do not like the overdone look, as we just had discussed just 20 seconds ago. But I do think that overall, this openness about plastic surgery, for the most part, not all, but for the most part, is a good thing, because there are certain things that happen when people are more open. So, for example, Like there's less stigma about plastic surgery, so people don't feel necessarily bad or ashamed if they want to go and do it. This also increases, the number of professionals that are out there. It increases the number of people who seek professional care as opposed to doing it yourself, right? Because if it's taboo and you don't want to be seen at the plastic surgery, clinic, then you're like getting the, silicone injections in someone's garage where you hope no one will see it.
So sketchy.
Definitely sketchy.
Yeah.
We have talked about that. It does happen. So, less stigma about aesthetics, I think, is a good thing. I think it does make it safer. There's more patient education out there. If people are talking about procedures, there's more information. And granted, not all of it is good. I see posts all the time that are just totally wrong about certain things. But more information is generally better. And I do think that there's more good information out there than bad. There is increased demand when people talk about it, which is good because it increases the supply of people out there to do it, which that can be good and bad. It drives prices down, but then you do get a lot of increase in people who are not properly trained. And we've seen, rise in medical tourism, which I am totally against medical tourism just because it's not safe. You get a rise in like non-plastic surgeons doing plastic surgery, which also is a really bad thing. But in general, the increase in supply of good plastic surgeons is good for the general populace. Some of the badder things, some of the things that are not as good is the potential for normalized unrealistic expectations. If everyone's getting plastic surgery, then people sometimes forget, oh, well, they look like that because they've had plastic surgery, and it becomes, oh, this is normal. And then for the people who may not, want to do plastic surgery, may have the, means to do it, it creates that unrealistic expectation. So you definitely want to be, cautious about that. More people know it's possible, I think, is good. I mean, just more options for people that, may have very potential psychological issues over certain things. There's been a lot of studies about how when people get things corrected, that a lot of their well-being metrics go up. We've talked about those studies in the past. We did talk about the rise of medical tourism, which is bad. Surgeons are now more pressured to do marketing. That is absolutely true. I mean, I do tons of marketing because there is so much competition out there. I think it's good as long as the marketing is, how should I say this? Like, not legit, but like it's honest. We have talked in the past about there is some shady marketing going on out there, even by some legit plastic surgeons, which are just, trying to set themselves apart. I mean, so I guess that's a good and a bad thing. And then lastly, the thing I think is really good is there's better peer support. If somebody's thinking about having a procedure done, it is pretty easy nowadays to jump on social media and find people that have had that done, and they can, get real life stories about what it is they're thinking about doing versus in the past, you just kind of go to the surgeon's office and the surgeon talks to you about it, and you don't necessarily have a chance to talk to people that have actually done it, even though you very well may know people that have had it done, but no one was talking about it back then. And now they are. And so I think that, and then there's the social media as well. So now I think patients have a increased ability to actually get real world experience from people who are thinking about having, or who have done plastic surgery that they're thinking about doing. So I definitely think there's some positives from this. Again, there's a couple of the negative things that, you just got to kind of keep check on. But in general, I think more openness, more education, more choice is always better, for pretty much anything, but even in the world of aesthetics and plastic surgery. So
I agree.
So, all right, I'm gonna recap this one real quick. 2025, a lot of things went down, but one of the things that went down that we talk about is the increase in people being more open about having plastic surgery or aesthetic procedures. There was actually an article in Vogue about it, which I thought was a good article, and I kind of went on a different spin on it, but there was a lot of good information in that, so hats off to you, Vogue. And I agree, there has been a sudden, almost tipping point of people being very open about plastic surgery, and this includes celebrities who historically would go to the grave saying that they've never been under the knife. Now you got celebrities going on podcasts, talking about the plastic surgeries that they have done, which then in turn lets the normal people out there feel like, hey, I can talk about my plastic surgery too. And we talked about on this episode how there are good and bad things that come of this. Some of the better things, I think, are increased information about procedures. Increased information is always a good thing. More peer support. There's more people out there that are willing to talk about it. So if someone's thinking about having someone done, they can get some real life experience from someone who's experienced. Also, there's more choice. When more people are talking about it, demand goes up and then supply goes up. There's more plastic surgeons. However, that also opens up a few bad things like the rise of untrained professionals doing plastic surgery, which we see all the time, the rise of medical tourism, which is a very bad thing, as I've talked about many times. So I think overall, 2025 was a little bit of a tipping point year where people really started being open about plastic surgery and aesthetics. I do think it's a good thing overall. You just got to watch some of the potentially bad things that might pop up because of that. So, all right, Brenda, you did a good job carrying me today. I was by myself again.
Good way to start
really
off
sad
the
to
year,
see Sarah not here anymore.
Yeah.
But I am excited about our potential new co-host, and I don't want to spoil the surprise. So you're gonna have to wait.
Yay.
Brenda, you in the audience.
Okay.
Okay, all right.
Excited.
All right, well, thank you guys so much for tuning in. You don't know how much I appreciate it. We love doing the show. We love talking to you guys. We're going to kind of keep pushing forward here with a new era of Nip Talk. Please leave us a comment. If there's anything you want us to talk about, I would love to talk about it. Just throw a comment on YouTube or Facebook or catch me on Instagram. So, all right, we will see you next week. Bye.